Okay, good. So welcome, and I'll do a roll call, but we will have a quorum. Before we start, call the meeting to order, and we'll start with the Pledge of Allegiance. And the flag is there. I pledge allegiance to the flag of the United States of America, which stands one nation under God, indivisible, liberty and justice for all. Thank you. Okay, and
Hey, Dan.
Dan, how are you? Welcome. And we'll just do a roll call of members present. Nina is here, Sandy Berman is here, Mary Ellen Schwartz, and all presents on site at the meeting. We do have a quorum. Okay, thank you. And thank you all for responding to those emails. I felt after two cancellations of meetings for lack of a quorum, we needed to make sure that we could have a third one before the summer kicked in, or have a meeting before the summer kicked in. So thank you for responding again. Old business, going to first approve the March minutes. If you have a chance to read the minutes, I'll ask for a motion to approve. This was back in the depths of winter.
Motion to approve.
Thank you. Second. All right, any discussion, corrections, edits that people would like to make? Yes. Hearing none, we'll consider the minutes approved unanimously. Okay. Thank you. All right. And Nina, had there been?
Yes, they met 6/8. So Sam's report, it looked like they had a bunch of events and trainings that the groups have attended. One was a medical reserve corps event, which is kind of like emergency preparedness and like what happens if you have to call down other folks and what that looks like. They had some youth service programs at St. Bees. They're starting their community health needs assessment soon, so they've been looking at different consultants for that. They continue to, I think Sands, does he chair the opioid settlement fund meetings? Yeah, so he's been continuing with those. They're putting together a task force, and it looks like they're leaning towards, this isn't official, but a mini grant program. So certain entities could apply for that funding, which is actually a pretty significant amount of money that the town will be getting for many years down the road. But they are working with Fairfield University prior to that to do a mini needs assessment, looking at where that money could be best used in the community. They have been doing, they have been using leave behind kits. So the PD, social worker, fire, any first responders that attends an event that there's suspected overdose, they have leave behind kits that they have Narcan or naloxone in them. They have information on where you can get support, that kind of thing. So that's become kind of a best practice across the state. And then I know we've talked about this, but they now have at least 3 or 4 of the naloxone cabinets where you can actually open up a cabinet, get Narcan or naloxone if you just want it for your own personal use to keep on you, or if there's an event that you need to use it on. So that's something that's new in the town.
Do they identify where those cabinets are?
I know there's one at the health department. Do you know, Julie?
We have one.
You guys have one at Bigelow?
The police, I think, might have one.
How would somebody access? I don't
They're actually open. They're not locked, and
is there a sign?
It's a clear plastic cabinet, and there is a very good sign that goes with it that actually kind of shows you how to use the naloxone.
Mm-hmm.
That's fairly simple. It's very graphic based, and then I believe there's other resources in there like pamphlets that you can also take. And so whoever has one is sort of in charge of making sure it doesn't need filling up again.
Okay.
So it kind of falls on the person wherever it is. So health department would keep
So
track.
one person would be designated
Yeah.
for keeping.
Yeah, that's kind of how
And
they're
is there
doing.
signage so that if someone needed it, they would know how to where it is and how to access it?
I don't know.
Like Nina said, there's a sign next to it. We have one. It's not advertised all over
Yeah.
town where you get one. I know like police and fire all have them in their cars, Parks and Rec, all the camp counselors and lifeguards have been trained in using them. But advertising where they are hasn't been something yet.
It's
No, I just
kind
didn't
of
know
like
if it's a
an
cabinet in the
yeah.
building, or there's something that sticks out.
Yeah.
From,
Yeah.
the cabinet indicating this is where it is.
It's kind of like an AED, like you want them as many as you can kind of in
Sure.
the
I'm
community.
trying to remember our training. You know, I
Yeah.
still have mine at home.
Yeah.
I'm trying to remember our I thought you have to use it like immediately. So like. who would
No,
have
it
time-
has a shelf life.
No, but you wouldn't have, if you had a crisis, you wouldn't have time to go to the health department and get it and come home and use it.
Right.
Like,
Right, that's why it's there. They really want
Oh,
everybody.
you mean
to
just
have
take it,
on them.
please take.
And
oh,
there's
oh, oh.
stigma, you can get it at like a CVS, but there's still stigma to going to a pharmacy and asking for
Oh,
that.
this
So
is
they're
just to have.
trying to just make sure it's available to people in the
You think
community
they need.
who need it and are, it's just an easy access point. Yeah, no, good, that's a good point though, but yeah.
The other interesting thing is that the health department is doing train the trainers so they can have people walk in and learn how to do Narcan. Remember, we had an hour.
We had it here. Yeah.
We could have,
Yes.
they could do it in like 5 or 6
Yeah.
minutes, or, just so that they can teach somebody who's picking it up quick to do it, which is great. Because
Yeah, I
that's
don't
a
know.
barrier for some people to sit for an hour.
Absolutely, and the actual administration of it is just, it's like any kind of news, yeah. I don't know if anybody saw, one of the videos that I got a lot of traction on was an overdose that happened at one of the Knicks
Yes, I saw that.
post party, and a woman must have had Narcan on her, and someone overdosed, and she jumped up onto this ledge where this person was,
Oh, yeah.
and she was able to administer it and probably saved his life.
Yeah.
And she was not related to him. She didn't know him. She just carried it with her, I guess. So it certainly does work, does save lives. They did Girl Scout and Government Day. They followed around some folks and they inspected some hair salons and they looked at ticks under microscopes. They have an intern this summer from Fairfield U, who's going to be working on QPR, water samples, and the Safe Streets Bike Project. Let's see. They had a staff bike to work day on May 28th. Did you guys have that?
Everybody had that.
Everybody had it. So that was a town-wide event, which I didn't know of. I thought that was kind of fun.
Oh.
They're continuing with QPR training. So if you don't know, that's question, persuade, refer. It's a suicide prevention training. It's not that long. Santina at the health department really has been taking those on. So they did one at the library, 15 people attended. There was one at town hall with 18 people. All the school nurses have been trained. I guess the challenge is that they only have 2 folks trained. So they're trying to increase that and figure out if they can get funds to train some more people in that. I think that's it. They have a very popular fall prevention program at the senior center. They're doing that again. They're already planning for their flu clinics, which they said seems early, but they've got to kind of estimate how much of the vaccines they want. They did mention the Fairfield Youth Needs Assessment, which I would imagine is probably on our agenda. So they had representatives at that discussion on June 2nd, continuing with their social media promotion. That's it.
Ooh.
Yeah, they got a lot. They do a full on update.
Oh, thank you for that, Nina. It's, when I hear things like the bike to work day, that's where you really miss things like the Fairfield Citizen News.
I know.
Not to be aware of,
I
like, it's just,
So
and I'm simply assuming that Girl Scouts and Government Day had a photographer attending as well. So I'm assuming there were pictures, but
Yeah, they said that's fun. They have that. I think they do that every year.
Can I ask you a question about the CPR training?
Yeah.
Do you know, is that something that, well, my first question was, do they have like an estimate about how much a training costs? Like,
So the trainings are free. The cost is to train people to become trainers. That's where they would
Oh,
be looking
okay.
for the money. I don't think it's incredibly expensive, but it's just, again, capacity.
Yeah.
But the health department offers those trainings for
Okay.
free. And I think their goal is to train as many people in the community as they can. It's kind of like they want everybody who does CPR training to do
Mhm.
QPR training, because it's sort of, they always say, from the neck up and the neck down.
I was just thinking with some of the religious communities in town, I know it's nice to have a point person trained in it, but many of these communities, similar to schools, I think, have leaders that kind of are spread out. And so
Yeah.
the more people that would know, or at least have some sense of training in knowing, what questions to ask, or at what point, where's a good point to say, okay, this is now a referring situation,
Yeah, and maybe reaching out, and I'm happy to mention it to Santina about offering it to faith-based leaders in the community.
Yeah.
They want to train as many as they can, like I said, and that's not a bad idea at all. It's a great training. If you guys have never done it, I recommend it. It's a great training. It's short, it's under an hour.
And how would you sign up?
Well, the health department does offer them, but I can certainly find out about upcoming trainings and bring them back to the table.
Do they offer cabinets? Is there a cabinet where you could go and, sorry?
I'm trying to picture what that would be. Maybe we could ask for training here. For the commission.
Well, it's about faith-based. I love that idea.
All right, well, thank you, Nina. Any other questions for Nina? Okay, and do they meet during the summer, Nina? Are you,
Yeah, I think they only take 1 or 2 months off, maybe one in the summer. I don't even know. Yeah.
again?
Yeah.
Okay, under new business, I have one item, that, we talked about back in March, and we haven't had a chance to talk about it since. But since we only have one more meeting before, the fall meetings, I thought I'd just raise it again, just more for discussion purposes than anything else. But we talked about creating a number of, at the time, I think we were calling them committees, but I think the preferred word here might be task forces, which would help develop the commission's agenda, develop support for the department. And we talked briefly about having an advocacy committee, and then in some follow-up conversations, and particularly following the presentation that was made on June 2nd by Emily, a youth-oriented committee that might help or support some of the things that were on both what will come out of the needs assessment and help that agenda move forward. And then finally, just to keep the momentum on issues related to disabilities in town. And I'm not quite sure of the status of what's happening with the Commission on Disabilities.
It's disbanded.
It's totally disbanded. So I think we need to bring that back into the agenda for Human Services. So right now, just to get us started and rolling, I'm proposing that we look to have 3 sort of working task forces. I don't have an agenda for the task forces, but it's really to keep the rest of, there'll be somebody who would be, or members of a particular task force would at least report back on activities that are related to that particular topic to the commission. And if there's commission work that we need to develop in terms of an agenda for that particular topic, it'll be supported by the entire commission. But I think over the next couple of weeks, what we might be doing, and hopefully we may be able to consider it a July agenda item, is just look for some volunteers on these particular task forces. I'm not anticipating this is going to be 25 hours of work a week. I think it's just keeping abreast of developments, sometimes acting as a liaison with other interested groups in town, or just bringing back information that we might not have access to otherwise. So I have 3. If there's other interests or areas of interest that members have, please bring them forward because we're happy to consider them. And I think what we're looking to do is have 2 or 3 commission members involved in each of the task forces. So there's a And there may be a lead commission member on one, but it'll give the chance for an alternative and it'll share the work as well when there is a little bit of work to do. And I'm not anticipating, as I say, that this would constitute work that any of us would consider to be a burden in terms of.
What were 3 again?
3 that I'm looking at are one for advocacy, which would be legislative and in town, perhaps budgetary, might move in that direction. And pre-COVID, we had commission members that would be actively testifying at town hearings and things like that before the RTM. I know Marty did that as well. And it's looking just to continue that, for that group to take a lead on that. And then the other 2 would be youth and disability. Okay, and I think on the youth side, we've also had some positive feedback from
Parks and Rec?
from Parks and Rec, sorry, who would, their commission would liaison with a task force that we might develop. So I'm gonna be in contact with the chair of Parks and Recs to see how we move that forward as well. And more than anything else, these might be reporting groups to the commission as a whole, or it might be an interested group that takes an initiative and brings it forward to the commission as well, which is really how the Commission on Disabilities got started a couple of years back. So I think there's some benefit in it, and it would provide us with a working agenda as we move forward. So if there's other interest areas that people would like to add to this list of task forces, I think 3 will help us get started, create an agenda, but it doesn't rule out other areas of interest that people might have. And I don't want to preclude any by having 3. There might be one that's more important than advocacy. But here we are. So.
Bernie, I like those 3. I'm wondering, so one of the thoughts I've been thinking about within our town is just, this could be an anecdotal observation, but I mean, I think that the occurrences of either suicide or mental health struggles seems to be just increasing and trending upward over time. Is there already a commission or a committee that is mindful of that? Okay, so is that something that there might be could that be a good task force that is, if not liaison with other committees in town, is just being mindful of opportunities to kind of raise awareness around mental health in general, certainly.
Right,
Yeah.
it's a great
I
idea.
didn't hear your response. Is there
There's
any?
not.
There isn't.
You know, the health department keeps a list of resources. We have resources, but we mostly use their resources because it's so comprehensive. And there's groups around, other agencies around that do, Catalyst. The hub used to be Catalyst, but it would be great to kind of pull them all together and to identify things. Part of the needs assessment did that. But, and the health with the QPR training is a big piece of it. That's a great idea.
So Fairfield Cares, which is the local prevention council, they're sort of, one of their main goals is youth wellness. So that really does take a big part of their work is around like youth mental health, and suicide is obviously a big part of that. That doesn't necessarily address adults. It really is more of like the under 18.
Yeah.
And then as Julie said, with this Fairfield needs assessment that Emily just did in her department, that definitely came out as one of the areas that, is on people's mind, and a lot of it is really understanding what resources are available, how you get them. So one of the things that she's trying to do and work with moving forward is to develop a really sort of comprehensive resource guide that is easy to update. The problem is people do these resource guides and then they sit there and then they're out of date. So she wants to do it in a really thoughtful way where does it live? Who's in charge of updating it? So that's on one of her like main tasks moving forward.
Yeah.
So definitely worth having a conversation with her or whoever ends up working on that. But yeah, it's definitely an issue that does sort of seep into all from beginning of life to end of life, right?
I think, my sense of it is to the point of like creating awareness of available resources. I think it is a very, very viable topic that falls within the broad definition of human services. And I know well, I don't want to put words in your mouth, Dan, but I think this involves a little bit more than we would not be good at being suicide prevention specialists. I mean, I don't think that's really where we're going with this. But I was also thinking about it in terms of for adults, and more particularly for older adults, the issue of isolation, social connectivity, things like that. I read a research paper recently when you mentioned fall prevention, that people who go through fall prevention have lower suicide rates than the general public. And the reason for that is because of their interaction at a relatively older age with another group. And it's social interaction that acts as a preventive. And I think developing topics around connectivity, isolation, things like that, that would address preventative issues related to suicide people. And these issues, I mean, it's, when we think about suicide, it's depression, anxiety, grief, lots of reasons. Providing people with some means of connectivity, awareness of resources, things like that is really antidote. But let's very much keep it alive. All right, I appreciate the topic.
We talked about that before, both for youth and for seniors, and like what would be the appropriate referral for those individuals. We talked about, I guess it's Parks and Recreation for youth. And then we talked about the police department had a social worker, but it's like, it seems like it's sort of, there's not one clear line.
That's exactly right. Well, it's
either youth or for seniors.
Yeah, it's complicated.
Nina's right with Fairfield Cares. It's not necessarily the lack of resources. It's when people are in despair, are they gonna, will they reach out? And it's got to make it part of the, just part of the practice of talking about mental health. It's vigils are great lists. We have a great resource guide that is outdated, but it's getting that out there. And
some of the resources already exist. It's a question of knowing how to access them.
Yeah.
I think the the AARP program, one of their areas is looking at social isolation.
It is, and same with Agency on Aging. Like
So
there's that gap 18 to 65 that is the danger. Yeah, that's a great idea.
If you look at the data, I don't know for Fairfield specifically, but if you look at the data around death by suicide, it's typically highest in like the 55 and older community. And it's, I think, the highest among white males, used to be anyway, last time I looked. So there's definitely, a need 100%.
That's why the QPR is so important, because it's
Right.
people who know what to know to pause to ask.
Yeah.
That's the thing too, like maybe from a town perspective, like we have an abundance of resources, but maybe, I don't know. I mean, so at the youth needs assessment, being there, I was like surrounded by people with social work degrees and things like that. And they were all saying like, oh, we offer this, we offer that. There's an abundance of resources, but I think it's almost like the need isn't the resource. The need is, how do we remove, like you were saying, the stigma with the naloxone and all that?
Yeah.
How do you remove the stigma of talking about mental health? And so, and I honestly don't know what the answer is. I just know it's very complicated. Like, and if, and so I didn't know if there is one commissioner or one place where this is kind of, part of their purpose, their mission. But if there's a way for a task force within ours to contribute to that conversation, I think, or at least pull in information from that to say, like, are there ways we can contribute to it? I think it's be a worthy use of our time.
I think we're it. I think it's a great idea.
Yeah, so let's say that we now have 4. All right, well, we need, I think,
Maybe they're just.
there's a definition around the other 3, but there may be some definitional issues around this one and how we define what the work might consist of and look at, but let's keep it very much alive. Access awareness.
Right.
And I mean, to the extent that there is a captive audience out there in terms of older adults who are other members or whatever else. There's things we can do.
Yeah, I
So,
mean, the stigma among youth is much better. I mean, kids are much more open.
Yeah.
Talking about mental health in a very sort of normalized way. It's the older, sort of the middle-aged and older age that are still very much unfamiliar with it or sort of cautious about it.
Dan, you were relieved from volunteering for the other task force.
All right.
So-
We'll always do this.
Thank you very much, Dan. We have one for you. All right. So I think if everyone is okay with it, what I'll try to do is either drop you an email, or if you're interested in any one of the particular groups, drop me an email, and we'll try to sort of roster this out with no binding commitments at the next meeting, and then we'll be prepared to do some work in the fall. So that's okay, all right? Okay, well, thank you for that. I have no other items on the new business. Is there any other new business commissioners would like to raise? Okay, hearing none, we'll move into the meat of the department update.
Let's just do some basics. The senior center has a new newsletter format. I should have brought them so you could see them. We're transferring over to to Canva. I don't know if that means anything to anybody. Brenda does it. It looks amazing. Not much else new there, just, regular activities. For social services, you'll see that I put at the table Emily's one pager on the youth needs assessment. For those of you who were able to attend that presentation, you know how amazing that was and how much work the town has to do. So trying very hard to pace it, make sure it goes great, but the one pager is there. If you want more information like the long report, happy to send it to you. We're working on updating our post-vention plan. That's for when there is an untimely death or death by suicide. We have one. We've had it for a few years. It needs updating because it's early on when we had our police social worker, and now that's a unique gift that we have in town. So stay tuned for that. When we have that completed, I'll bring it to you.
You used a word I don't think I ever heard before.
Post-vention?
Yeah, post-vention. I mean, I know it's obviously
Yeah.
me, but that's interesting.
Yeah.
So you're planning that around today's event or?
No, and we don't know what today's event was. So,
And typically, just so you know, if there is sort of a fatal, unexpected death in a community, you don't do post-vention training immediately. You actually want to wait, kind of pause a little, make sure there's been enough time that's passed, and then you kind of pull people together to work on it. So, I mean, it's great that Fairfield has one in place because a lot of times communities just haven't needed it and they're kind of scrambling and they don't have sort of a network of people to engage. So,
Dan, I think you were on that committee.
Yes, yeah, sorry.
yeah.
My mind was going around like.
Yeah.
I do have a question. Last time we were here, we were talking about May 1st being when the Americans with Disabilities Act will start including dementia. And I'm wondering what, as at our senior center and social services, are we putting into place for that?
I'm really glad you brought that up. Risk management is working on what that plan looks like for not only our department, but townwide, especially customer facing departments. At this point, we don't have it yet. I know he's working diligently on it. What we have so far is the change that we could see that we have to do is rather than when when a senior comes to us and starts showing signs of dementia, typically we have a conversation with that senior and or the family member and say, it's not safe for your loved one to come here without somebody with them. We need now to document that and then give them a documentation saying, at this point, you're required. We don't have to change the services we provide or the programs, but we do need to just document that we had a conversation with somebody who shouldn't be there without somebody with them. We don't have staff to support somebody being dropped off for the day. We're not a day program. We don't need to change that model, but we do need to have in place what the steps are that we have to take.
So is there is there a place, because we don't really, I see a huge need we have cognitive decline, and they haven't declined enough where they're an adult day program candidate. But they do need the senior center, but they are moments of forgetfulness, not wandering, but forgetfulness. So under the ADA now is not just you. Is there responsibility on the community's part to meet the needs for these people? Because giving them a piece of paper saying you can't attend, you know what I mean, versus what are we doing to accept them and incorporate them?
I just want to be clear, that's the last step. That's after several conversations. When we notice that somebody is not safe on their own, that's when we have to take those steps. But additional programming, no, because we're independent and self-directed. So, family members can come, companions can come with them when that happens. And that does happen a lot. And we have those conversations, and they're not a surprise to the loved ones. So, do we have programs? We did have a brain wellness program. Heather Gately did that for several weeks. We do have specific know the signs, Alzheimer's. We do have brain games, memory games. We have those kinds of programs. But in terms of the town, doing things at the library, that we're not there.
So at the point that you reach that determination that the person needs some support to come to these programs. So is there any way, are there volunteers or anybody that could be of assistance so that they continue to come? Because if not, the worry is they're gonna go downhill faster. So I'd hate to say, well, because they show the early signs of dementia, they're disqualified from a town program without offering an alternative.
Right. Well, the alternative would be they'd need to bring somebody with them. We don't have a volunteer program for that.
It's something to work on. If there are people that might be interested in volunteering for that purpose. I don't know what the numbers are, but.
Yeah, it's an interesting idea. Flags are popping up in my head about what the risks would be, but it's certainly worth looking into.
So it's not I know the lawyers are working on this, or the risk, but coming from a school background, school background is if you can't safely access this, then we've got to pay we got to make sure you can, and we're financially responsible for getting that person with you. So I don't know if it's going to get to that level.
That's a law, isn't it?
It's school.
Yeah, for us, it's not, because we're.
Free access is the law. So if you need it.
Right.
Obviously, the law's in place because there's obviously a need.
Right.
So it would be great to be thinking about.
There's definitely things that we've got to iron out and make available, but that day programs are there for that next step. And I understand people aren't there yet. We try to keep them with us for as long as possible, but sometimes it's just not safe.
No, this is what I live, I live this. So, there's this void, and the whole idea of, and I'm not trying to put you on the spot, but the whole idea of these people have been paying taxes. The school budget is 8,000 students and takes up 65% of our budget. And we have our elderly here that want to stay here and need these support services. Isn't it time that we start addressing that? You know what I mean? Instead of, my kids didn't go through the Fairfield public school system, but that number, I believe, is going down, and our numbers keep going up of what we're spending and what's happening for the rest of the people. Because having something where, and I'm not putting you on the spot, but having something where you have someone who's a little forgetful, believe me, they don't qualify for the adult day program. They don't qualify for memory workshop. It would be terrifying for them.
Yeah.
But having someone available to cue, or something like that, it's missing, and not just in Fairfield.
Yeah.
It's missing.
Are there?
I was gonna say, would that be something that would be helpful to kind of include as not a charge, but a task of like the advocacy group? Because it's like speaking up for the budget in town and kind of saying, hey, this is a need we see visibly in town, and who's the voice that speaks up for that?
Right.
I would think it might be for a disabilities task force to come up and do the homework to see what's out there.
I was just gonna say, are there any models you've seen in your travels that work in other communities, with this
I'd have to really.
great space?
There's an incredible program up in either Plainsville or Plantsville. I always get the two of them mixed up, and it's the former Alzheimer's Association, and now it's called Live Well. And the program they have it should be a national model of what we do. And the town of Avon and the town surrounding there help, there's some relationship there, I'm not sure what. I've asked LiveWell, would they consider doing a pilot or a satellite program here in Fairfield County, and they're not interested. You know what I mean? Because of the money, a bit, but that, you know, as you're seeing more and more dementia and you're seeing this in the community, I mean, they're building a whole town someplace up near Madison, Wisconsin. What we're doing in Europe is unbelievable. I think it's New Hampshire that's doing some incredible programming. It's just, you know, this is the tsunami. It's here. You know what I mean? And honestly, a lot of people just bury their heads in the sand, and these families are floundering out there. So, you know, doing something where the school, you know, so I don't know how the schools all of a sudden got funding and it's mandatory reporting and all that. I don't know how that happened, but you know, we've got, pardon?
A lot of advocacy.
So, you know, so that's 65% of our budget,
And a lot of suing.
you know, so.
Right.
So, you know, I'm one person, do you know what I'm saying? But it's just, it's a real, in this town, the phone calls I get from people about social isolation, moms falling, moms having memory issues, too early to put into dementia care, you know, and it's just I'm trying to put some Band-Aids on it, so.
That's a
I
great.
know there's emerging evidence-based community structured early memory loss programs coming out.
Mhm.
But are these individuals before that stage, do you think, or
Yeah,
would they
They probably,
benefit by participating in an EML program?
yeah, they would,
They
you know what I
would,
mean?
okay.
It kind of, you know, everyone's on a sliding scale on this, right? So you
Yeah.
have some people who just forget where their keys are and the kids think that they have dementia.
Yeah.
And there are others who, you know, literally are, you know, but, you know, so it's a sliding scale, but we're missing that.
Yeah.
You know, I mean, Heather had a great program like this in Norwalk, and unfortunately it didn't get the legs. And it was an incredible program where you drop them off as kind of the LiveWare model. And it's almost like college for people with dementia. So you could choose to do an art class, or you could choose to do a yoga class, or you could choose to do a lecture, you know what I mean? And they come together for lunch.
Right, and the family member could stay or
They
not
could stay or not stay.
They had a recording studio, yeah.
You know, so something, it would be,
normal.
yeah, it was in
Yeah.
Norwalk.
Not at all.
No, no.
Okay, well,
Um,
let's make sure that as we develop, and whether it's disabilities or another name on it, that we're not just referencing physical disabilities when we move forward. Maybe disabilities isn't the right name or title, but let's keep this subject very much alive, both for advocacy and for however we evolve into talking about disabilities. Because I mean, I know the other thing that's happening just in early memory loss programs is that there's some responsibilities by healthcare providers for their community work. And one of the tasks that they're taking is providing EML programming. And their biggest cost is finding partners who can provide the space more than anything else. They have the trainers and things like that, but it's really scheduling space and things like that.
And one thing that's getting a lot of growth right now, Massachusetts has something like 180 of these memory cafes, which are 1 hour things once a month. But now Wilton is holding one. I think you were approached, or there's something.
Trumbull has one.
Okay, Trumbull
offered, but-
Trumbull just did one, which at least it brings these people with early to moderate memory loss together as a community with their loved ones. So there's some socialization, they're meeting each other, and there's some support. So Connecticut, I have to say, in the last year or so, is really trying to make those programs grow. You know, there's just a lot of need.
Yeah,
A lot of need.
the Trumbull one is done by the company that owns like Cambridge Manor and Ludlow.
Yeah, national
Yeah.
healthcare.
I think Wilton is Greens of Cannondale maybe, but they have the
No.
money to do.
Yeah, it's Wilton Library with RV&A.
Oh, that's okay, B&A, right.
Yeah, RV&A. So, and Wilton Library took it on, the head library in there, which was amazing. You know what I mean? Yeah.
We had a day program in our building pre-COVID that was run by Mosaic. It was well attended, it was great, and then COVID hit.
Are we saying like that, like the issue really at the core is like money as the resource, or is it like
It's
volunteers to fill?
it's finding, yeah, it's programs, I'm sorry.
No, it's okay. I mean, I'm trying to like put my mind around like what is the kind of core issue with providing these services or meeting these people in the gap?
I feel like it's finding a model that we can replicate and finding somebody who's gotten the structure that's necessary for the safety, the risk, the town, and finding space for it, I think is less of an issue than finding what it is. That would be a great thing for disabilities.
Yeah, I know the Fairfield Historical Society is tied into the Alzheimer's Foundation, and they do little outings during the summer, maybe once a quarter or something like that. But I've called art studios in the past, I don't have the time to do this anymore, to see if they would organize a class of maybe 10, and no one's interested. They, you know what I mean, even art therapists aren't interested.
We do, our art classes do have a few people come with their companions. It is great. It is great. It'd be great to expand that too.
All right, well, that's all been very, very helpful and useful. I think we are seeing gender emerge on various topics, but thank you for that contribution. Julie, I think this was you. Are you anything else on town?
So not for town, but next month, Laura Snow Robinson from Mosaic is going to come talk about CAPE, which is I have to read it. Coalition for Abuse Prevention of the Elderly. They have a shelter, they run wonderful programs, and we have a quarterly case review that social workers and police attend.
Mosaic.
Yep. Yeah. So she'll be here with us next month. That's it.
All right, thank you. Is there any other business anyone would like to raise? Okay, in light of our last conversation, just remind everyone that we have a scheduled commission meeting on July 23rd, our last before the August recess. So, and again, thank you for taking the time to attend this afternoon. Good to see everyone. A motion to adjourn? Moved. Seconded, thank you. All in favor? Very, very much.